And at this time, we have 5 minutes left for the entire discussion question. So if we can let the panelists as well as the abstract presenters just be close to a microphone, we go ahead and invite 1 or 2 questions left for the session.
Do we have anything on the...
Yeah, we do have a question on the chat room.
So the question from the chat room is from Dr. Stefan Pokal, who asks a 2-part question, and I believe this is for our one of our abstract presenters. But what's the exact definition of penetrating injuries, and what are the different types of injury mechanisms that were meant by that term? And second, if I understood correctly, you saw more penetrating injuries, but not just in child abuse cases. That was overall among all documented injuries. Is that correct?
I think that was for Dr. Yu. Is that right?
You still here?
They did not comment who the question was for.
Oh, thank you. Unfortunately, I think that's the...
They've left? Okay.
Yeah.
Any other questions from the audience? I saw someone standing up.
Hi, it's Liz Berdan. I'm from Tacoma, Washington. I'd like to commend APSA for talking about this very difficult conversation in a number of different areas. And I think firearm protection and counseling for our patients is a big one. I know in my social review of systems, I talk about this with every single patient, and the data has driven how I have that conversation with my patients. I've been written up as a patient, as a physician, talking to my patient about these very important conversations. And I think it's also important for us to think about what other risks do our patients have when they have penetrating trauma, if they have penetrating trauma, if we're seeing them in the emergency department for such an injury. Other risks would be domestic violence, human trafficking, just to name a few. So I appreciate the conversation that we're having, the education that we're having, and thank you very much.
Thank you for those comments.
Yes. Ayla Stanford, Philadelphia, HHS. So my question is for Dr. Yu, and since he's back here, I'll ask. I first wanted to say thank you for dispelling the subjective narrative with objective data. And I'm going to talk about that a little bit tomorrow, but that is so critical, and we heard that a little bit this morning with Mr. Stevenson, that African-American men are more violent. You showed with your data that was not true, that they were under the influence. You showed with your data that was not true, that they resisted arrest, they were nonviolent, that was not true. And it goes against the narrative that the use of force was justified, which is what we hear so often. So I wanted to say thank you for working towards health justice, but my question is, what do you plan to do with this information?
Yeah, thank you for that. I don't know that I have the most ideal response. And as Dr. Hsu mentioned earlier, I gave a similar talk in the trauma panel just a moment ago, and Dr. Upperman asked me a very similar question. I think there's, I have 2 thoughts. One is that, we've all seen very clearly during COVID that pediatric surgeons and our opinions are, I believe, very well respected by the community, regardless of what political alliance you may or may not have. And so as far as what I can do, what we can do as a community, I think we need to continue to do this research, continue to speak to the data and the facts. I think we need to allow the data and our love for children, for all children, be our North Star for how we navigate this incredibly difficult situation. As far as practical things, I also mentioned this in the trauma room, but when when I was a general surgery resident on the surgical oncology service, a surgical oncology attending taught me to take care of cancer, we have to name it, stage it, and then treat it. And I feel like that is my approach to this problem. So right now we're naming it, we're defining it. I think that the next step, again, I mentioned this before, but there's an author named Wirtz who came up with a whole classification of legal intervention homicide. It's a typology, there's 7 groups. For example, in group 1, it's an individual who's in committing a violent act like murder. The police show up, and that individual then tries to murder police. That's obviously a completely different category than the 7th category, which is essentially a person who was, in essence, minding their own business and then was shot. I think it's our next project is going to be to take this NVDRS data and classify it, perform the typology to see what class most individuals fall into, stratify by race, and depending on what we find, I think there might be a role for intervention then. Thank you.
Any other questions or comments? I have one for our president, Dr. Barksdale, and I hope this doesn't delve into any of your talk for your presidential address, but I know that you've done a lot of work in the city of Cleveland around fragility and the work that it has had the impact on our youth. And so if you would indulge us for the last few minutes of our symposium to tell us a little about that. And
So I'm going to ask if I can defer that a bit because that is a part of my presidential address. But since you set it up a little bit, the first thing that I'd have to say is that I am humbled. This work was phenomenal. All of you who are presented, you know, when we came here 20 years ago, I would never imagine being in a session like this, and your insights are important. And a part of this, I'm going to say in my talk, I want us to take these social determinants of health and advocacy to the level of science. And a bit of my talk tomorrow or 2 days from now, you know, when I had a basic science lab, I did neuroblastoma research. I'm interested in tumor vaccine, and we did tumor vaccine development. And what Pat Donahoe always told me when it came to solving problems, she said, follow the science, follow the science. And in my mind, that meant follow the basic science. But I'm so impressed that you guys are following the science, the social science, and that we must have the same rigor, discipline, and commitment to following the science of human behavior as it relates to the health care, and lifetimes of children as we have when we've been looking in the test tube and in vivo models to determine the behavior of tumors. So I'll defer by just saying I'll talk about the anti-fragility, but just to give you a little bit of the term is that, and I'll guess, I have just a minute I can say. So when I came to Cleveland to be the chief of surgery, I thought that was the bomb for me as a kid who was a first-gen kid to go to college and someone who'd done science. But what I realized is that violence was the biggest cause of death and disability in our urban centers, and we just recently saw a New England Journal paper that says it's that way across the country. And so I saw fragile kids growing up in chaotic environments, and we were not doing anything to impact that environment. So as we keep looking at the guns and we keep looking at the violence, I'm going to ask us as we move forward, and I want to bring some of you into this effort that we want to move after our presidency, is to focus a little bit less on the vector, that is the gun and the bullet, and more on the victim. Because we look at murder, but we don't look at morbidity. There are children who are victims of violence that are falling into this treat 'em and street 'em mentality. And when I look at all of this energy and talent here, there's so many of you who can take us from health, can take us from despair to health to hope. So thank you so much. I didn't answer your question, but hopefully I'll do a little more in depth.
Okay.
Thank you, Dr. Barksdale. Well, our time is up. I really appreciate, and the rest of the DEI committee really appreciates your time and attention. There's further information on the Pediatric Resource website. The DEI committee has worked tirelessly over the past couple of years to put significant amount of information for your available consumption. Apart from that, I want to remind everyone that there's the wine and cheese reception outside in the hallway here or so forth. I think it's in the exhibit hall, actually. Please partake in further discussions with the presentation presenters, abstract presenters, and the panelists, please. Thank you.